Aloha, everyone. I'm Dr. Tom Johnson for Planning Total Health Center, your one-stop holistic health shop. Today, we're continuing our discussion on arthritis, both osteoarthritis and inflammatory arthritis. As you know, arthritis is the most common cause of pain, disability, dysfunction found throughout the world today. Let's talk about frequently asked questions today. So I've collected the most common asked questions that I've received over the many years in clinical practice. So let's get started. 1, is chiropractic care good for arthritis? Yes, of course it is. However, not every chiropractic clinic is on the same level in terms of the services they offer and the specialty and the experience handling complex arthritides. So while chiropractic care is good for arthritis, you need to choose your chiropractor wisely. Okay, we all have different specialties. And so what separates us at Clinic Total Health Center in terms of chiropractic care for arthritis is that we're a multidisciplinary and integrated approach to handling and treating arthritis, ranging from our medical team, our medical doctor, our physician assistant, nurse practitioner, all the way to our physical medicine team, our chiropractic doctors, physical therapy, massage therapy, acupuncture, clinical nutrition. So we need an integrated and multidisciplinary approach to treating your arthritis. Now, specifically, when we talk about chiropractic care, what we're really talking about when people ask that question is, are the chiropractic adjustments good for arthritis? The answer is yes. Let me tell you why. The answer is found that's really simple. If someone has really stiff and tight hands, but you never stretch them out or you never adjust the joints, that will predispose you to early arthritic changes. Next, let's say that you had a shoulder injury, you dislocated your shoulder, and now you have hypermobility in the joint. It moves too much. That will predispose you to arthritic change as well. But now there's a condition right in the middle where I gently stretch my joint. I release the pressure in the joint. I restore normal range of motion to the joint through chiropractic adjustments. That targets, treats, and prevents arthritic changes directly. Let me say that again. Chiropractic adjustments done in the right way to the right type of joints will prevent and treat effectively arthritic changes in that joint. We need to restore the normal range of motion to that joint. It's very simple. However, you need someone that is a specialist in adjustments, chiropractic care for arthritic joints. That's where references from family and friends, doing your own research here on the internet or listening to our videos, understanding how we differ from other clinics. Next question. Does chiropractic care make arthritis worse? Generally, the answer is no, unless it's done incorrectly. I found that sometimes I've seen some physical therapists performing joint manipulations that they call chiropractic adjustments, but because they're not as well trained as some of the chiropractic doctors, yeah, there could be some injuries if you're not a specialist in adjusting that joint. Most chiropractic doctors are specialists in joint adjustments. However, some of us have more experience at complex arthritides, such as myself. I've worked with a wide range of common arthritides from osteoarthritis to inflammatory arthritis. They need to be cared in different ways. So yes, chiropractic adjustments can help. No, they typically don't make it worse. However, when you start adjusting joints and you start breaking up scar tissue and adhesions and arthritic changes, sometimes there can be a temporary spike in symptoms. In the same way, if I sent that same arthritic patient to the gym and told them to go exercise, yes, you can have some flare-up or exacerbation of symptoms because you're breaking up and loosening up scar tissue and adhesions. Totally normal. As long as we restore that joint back to normal range of motion and stabilize it with corrective care exercises, therapeutic bracing, and lifestyle changes, we can improve your arthritic deformity and arthritic pain. Another question, really similar, can chiropractic care help with joint pain? Well, I just answered that. Very similar. Is massage therapy good for arthritis? Yes. Massage therapy can target the soft tissues around that joint very effectively. It can help you with pain, inflammation, swelling. It can help circulate the tissues. It can help stretch out the tissues. However, massage therapy alone will not correct or fix your arthritis. Why? Because you're only focusing on one or two of the elements of arthritic joint pain. Again, remember, arthritis affects joints. It does also affect surrounding soft tissues that need to be addressed, such as massage therapy or active release therapy. However, the massage therapy won't directly target the joint itself. That's where the chiropractic specialists come in. We need to target that joint specifically in addition. So while yes, massage therapy is good for arthritis, we really need an integrated team approach from massage therapists, chiropractic doctors, physical therapy, medical procedures, and medical team as well. We need an integrated approach, and that's what separates us from all the other clinics here at Clinic Total Center. Next, does popping your back, your neck, your fingers cause arthritis? Yes and no. I just answered that question. Let's review it again. If I never adjust or stretch or manipulate my fingers, for example, and they become really stiff and tight, they will become arthritic very easily. If I, for example, injure my joints, my hands, or my shoulder, my neck, or my back through a car accident or a sports injury, or we do some crazy procedure we saw on the internet to adjust our own joints by ourselves, and you caused injury and you caused that joint to become hypermobile, yes, that is bad. That will cause arthritis too. But if you have a specialist perform these specific joint adjustments, that will prevent and help treat the arthritic change and deformity and dysfunction and deficits. Hope that answered that question. So let's review again. Do nothing for the joint, becomes arthritic. Injure the joint, becomes arthritic. The one in the middle, meaning that gentle adjustment stretches the joints, restoring normal range of motion, prevents and treats arthritis. It's about as simple as I can say it. Next question, can chiropractic help with inflammation? Yes. Let's think closely about what inflammation is. Swelling and inflammation from either a flare-up or new injury. All right. There are chemical messengers that stimulate nerve receptors that trigger pain responses. We need to focus on that inflammation in the early course of care. That's where our integrated approach works really well from our medical team and our physical medicine chiropractic team as well. The adjustments will help restore normal range of motion that then will improve the circulation of that inflammation and swelling. We need to pump that inflammation swelling out of the joint and out of the surrounding soft tissues so they stop triggering inflammatory pain. We need to target the inflammatory component of your pain first and foremost. Later on, we'll target the more specific dysfunction or functional deficits of that pain as well. Next question, what's the best vitamin for stiff joints? Well, there is no specific one vitamin for that. But at Clinic Total Center, you will sit down with our clinical nutritionist that is a specialist in bone and joints and nutrition. It all starts with an assessment, consultation, history, understanding your injuries, understanding the deformity and dysfunction you currently have. What phase of arthritis are you in? Are you in early mild arthritis or are you in severe deformity and arthritic pain and dysfunction? So yes, vitamins, minerals, healthy diet, and lifestyle all can help reduce inflammatory pain and arthritic pain. Next, how often should you get adjusted by a chiropractor? Well, that depends on the treatment plan. So it all starts with a comprehensive physical exam and diagnosis, understanding what type of arthritis you have, what degree of dysfunction or deformity or stage of arthritis are you in, how's it affecting your life at home, at work, and your overall life. And so that answer can't be easily answered. Once we restore the normal range of motion of that joint, however, and we support it with corrective care exercises and therapeutic exercise and developing healthy habits and active lifestyles, that will reduce the need for your chiropractic adjustments as you already are getting healthy. Now, we always recommend maintenance care, healthy care, similar to just going to the gym and practicing good healthy habits. But that's another topic. Next, what role does an integrated multidisciplinary healthcare team play in the treatment and rehabilitation of arthritis? You already know the answer if you just listen to this video in depth. The integrated multidisciplinary team is the current state of the art of treating your arthritic pain. If you are going to a clinic that does not have an integrated multidisciplinary team, you are at a clinic that is 50 years old. That model is gone. If you're only on the medical side, or only on the physical therapy side, or only on the massage therapy side, or the acupuncture side, or only on the chiropractic side, that is an older school approach to treating arthritic pain. The more modern approach and state-of-the-art approach is an integration of services all under one roof, where our providers and therapists all collaborate and talk with each other. We all treat the patient. We are all helping the patient at the same time. That is where the results will come. That is where the benefits will come. That is how we're going to get you back to health, back to your life, and feeling great again. Hope this answers most of your frequently asked questions. Don't hesitate to reach out here at the clinic. Give me a call at the clinic or an email. Looking forward to seeing you all in the clinic. I'm Dr. Tom Johnson from Pawnee Total Health Center, your one-stop holistic health shop. Mahalo and aloha.